And now, the Golpa Cosmetic and Implant Center presents Journey to a New Smile with patient Jim Filberto. Day 1, Arrival. Talk a little bit about your dental experiences before.
Growing up, we were lower income, so dental education was lacking, and the solution to any dental issue was extraction, unfortunately through the years, you can only take out so many teeth and repair, as I got older. I guess my bad dental hygiene, it had impact on my teeth. I used to have a nice smile. That's what I want. Again, that's what I would like to have Dr. Golpa, provide for me. Over the years, I tried to take care of them. I spent a lot of painful time in dental seats with dentists who weren't looking at the whole picture. It was, I don't want to say the dentists were bad. I mean, I did come across some bad dentists. One who convinced me to shave down my upper teeth, which still looked pretty good, but he said this would be, the solution. I let him do that. He put in a bridge, which I'm gonna, show you. It's crooked.
Right.
You can see it's on an angle.
Right. So, what's interesting? So after all of that, because it sounds like you've been through a lot, how did you find Dr. Golpa?
Well, initially, back in New York, there's another dentist who advertises this procedure tremendously. I mean, you hear him on the radio and the TV ads and everything. And so my wife and I went and sat down with, in this office and had a consultation. We discussed, what it would entail. The dentist he explained things, a lot of terminology I did not understand. My wife was very supportive of the whole process, and she wanted, she was being proactive. Okay, let's do this. And then I started doing research into this doctor, and then I started finding things online from other people, which this is the day and age of the internet. If you want to research somebody's work, you can do it. And I work in the industry, so it was easy for me. So Dr. Golpa came up in my searches throughout the internet. I saw his name mentioned. I went to some boards, where people were talking about the procedure and what it involved, and I started actually researching Dr. Golpa and trying to find, people who have actually had this procedure done with him. Then I communicated with a few of them, and back and forth. We discussed different aspects, shared pictures, looked at, what the whole office, Dr. Golpa's office, was about, because that's an important thing. And Dr. Golpa's office, from the people I spoke to, they were raving about them. And at that point, and we had done a bit more research into the process. I at that point had actually had a CAT scan done to determine if the bone was right. Well, I ended up calling Carlos. I was annoying, I'm sure, but he was very patient, and he got back to me. He responded to all my email questions. He responded to any requests I had to call him. And, I was very skeptical at that, in the beginning because of my previous experience. And then after everything with Carlos and then speaking to Amanda, I still haven't spoken to Dr. Golpa, but all my questions were answered by the staff.
Jim, are you ready? Come on back. She can stay back here for now. We're going to take some x-rays and stuff, and then we'll bring her back out there when we start talking about everything, okay? How are you today? Great, thank you. All right, we're going to go right this way.
Follow you.
Follow me. All right, have a seat right here. Where are you coming from?
New York.
Where at?
New York, Long
New
Island.
York? Okay. Right. So my name is Amanda, so nice to officially meet you.
Another Amanda?
And yes, another Amanda. We got a couple. And Valerie over
Valerie,
here.
I'm another assistant.
So,
Nice to meet you.
We're going to take care of you today, all right?
We'll just place this over here.
So what we're going to be doing today, I'm going to go over a couple of things with you. We'll take some x-rays. We'll take a CT scan. We're going to take some pictures inside the mouth and outside the mouth. We'll go over the whole procedure with you from start to finish. We'll go over the model and the titanium bar. We'll go over that with you. We'll go over the shade, the look of the teeth, so that way you get to pick what you'd like. And then we'll take your blood pressure and all that, of course, to get your baseline. And then
That's going to be through the roof, I'm sure.
yeah, you have high blood pressure. I saw.
I'm on
here.
medication.
You're on
yes.
medication.
Yes.
Okay. So just for the heads up, continue to take that in the morning. When you take your other medication, just go ahead and take that as well.
No.
Okay?
Yeah, no, I've been taking all my medications except for the aspirin, so,
Good.
you know.
All right. So we'll start with the x-rays then, and then we'll go from there, okay?
Sure.
So we're going to be taking quite a bit of x-rays here, so just bear with us and go ahead and relax, and we're going to do the work for you, okay?
It's easy for you to say.
Alrighty, so now that we got the x-rays and the intraoral pictures done, we're going to take some regular photos now. And open just slightly. Yeah, so everything opens to and smile big. Let's go ahead and get you your CT scan, and then Dr. Golpa will come in and answer any questions that you have, and we'll go from there, okay?
Some of the things that you saw in the videos that you really related to.
You know, I'm not a big emotional kind of a person, but I saw people, just well up and start to cry, and as they were describing, you know, how their life was before, and, you know, it's just like, somebody flipped a switch. You just become that person, you know, because you experience that. You know, I wake up, I go to brush my teeth, and I look at it, and I'm like, you know, how, why, you know, I got to do something about this. I'm out with people, friends and family. Somebody says something funny, and I'm like smiling, hoping, you know, my mustache is, you know, sufficiently long enough to block this gap, you know, this missing area. Or hide the, you know, down here. I don't want to drop my lower lip, you know. And when I heard people talking about that, and, you know, one guy was standing, he was sitting next to his wife, and she was talking about it, and he started talking, and I could see his emotion because how he felt for her, you know, and, you know, it just makes it real. It makes it, you know, this is how it is, and you know, for me and my wife, we talked about it, and we, you know, it just became a realization. There's a chance, an opportunity to do something about it, and to really have a big personal impact on your life and how you feel about yourself, and just you know, the smile part. You know, I keep going back to that, but I used to smile so much. And I don't, you know, I really am so guarded with that. And, you know, you feel that. You feel that on the inside.
I looked at your CT already. Everything looks pretty straightforward.
Yeah?
Yeah, that's good. Really straightforward case. You just have to remove that one implant that you have. It shouldn't be a big deal.
That has to come out.
Yeah, it's gotta come out, yeah. it's going to be on our way to place the implant. So to place our implant, plus the housing and everything is different. The connection to the bridge is completely different, and you do have a lot of bone loss, which is okay with all on fours. Still, it's gonna work. You know, I looked at your pictures, the ones you emailed us.
Mm-hmm. Did you see the these? And I was taught they're not high definition pictures. I just wanted to,
You wanted to look similar to what you had before?
Yeah.
Because you did send me this picture as well. And this one is.
That's what I kind of
want to shoot for, want to aim for.
All right. Yeah. No.
Yeah, we can. Yeah, we can do anything you want with the teeth.
You
Okay.
see this?
Right.
This bridge.
Mm-hmm.
You see how it gaps out here, and it just feels like it's pulling on my
I
whole
see.
jaw.
Right.
So, I guess wanted you to not look at these and think this is anything that I want. You know what I mean?
Right,
What's
right.
here?
Yeah.
So
No. I know that's not what you want, what you had already. So
No,
we're gonna. I think one thing that I really like this one.
Can I show?
Yeah, the middle one.
Oh, the middle
I really
one, yeah.
like that. You know, I think it's very natural and basically we can do whatever you like. You know.
That
The good
middle
thing
one was
about
nice.
this bridge is we can make changes. You know, if something I don't like, we'll change it. If something you don't
You
like,
like the
we'll
middle
change it.
one?
So
And he
Yeah.
likes the middle one.
yeah,
Yeah. So far, I've seen nothing but a real.
great. Yeah.
Well,
This
that's
is all we
not
do. All we do is all on full metal construction. That's all we do. We don't do anything else. We don't have time to do anything else.
Well, that's good for you. Thank you, Doctor.
Pleasure meeting you.
It's a pleasure.
Thank you.
Looking forward tomorrow. It's gonna be a great change. Just enjoy your time tonight.
I will.
You'll be pretty sleepy
Yeah.
tomorrow.
I like it if you're sleeping through it.
Yeah, you could probably go see a show tonight. Great, so we have all the documents, we have all the data, the x-ray, CT, I looked at the CT, everything looks great.
Okay, great.
Again, thank
See you tomorrow, you bet, you bet.
All right, thank
Pleasure
you.
meeting you. Are you coming with him tomorrow?
Yeah.
You are? Okay.
Yeah.
She's
Why,
very
you know,
interested.
No, it's fine. No, you're gonna,
I'll have
the
my,
girls will order you lunch
You
and
do
all
have
that.
So I
Wi-Fi,
have-
right?
Pardon?
Yeah,
You do have Wi-Fi here, right?
Oh, yeah.
She's-
Yeah,
she
yeah.
she has to go on Facebook.
Yeah, we have a Wi-Fi. If
Yeah, no, I'll
Do
be
you,
fine.
do you have video
Yeah.
poker here? She likes video poker.
You could use our consult room if you want a quiet, relaxing
I'll be
place. So,
fine.
Thank you.
I'll
Yeah.
be fine.
great. Sounds good.
She's a
Okay.
trooper.
Awesome. Great. So, we'll see you tomorrow.
Back. We're with Jim again, and talk a little bit about, and if you feel like it, the anxiety and what you're anticipating and what you're thinking about today.
Well, yes, after yesterday, it was, very nice meeting everybody, talking to them, going over the different, and it was a lot to take in, but they were very patient and we went over a lot. They answered my questions and things. So we went back to the hotel, had dinner, and it was a pretty early night, I was, I guess, kind of tired from just the whole, day, the anxiousness of the day for me. And so I dozed for a little while, and then I was on and off all night. But then woke up this morning. James called, said he was going to meet us, told us when he knew where he was going to meet us by the lobby of the hotel. Picked us up, and the hardest part was not having my coffee this morning. So that's now I'm here and I'm looking. It's like one of those mixed things. I'm really looking forward to getting on. Getting this done, fixed. But you always have that little anxiety. So and that's where I'm at right now. But I think. My wife keeps telling me, and I believe it. This is the place to be for this, and I'm ready.
All right, Jim, come on back.
Hi.
So how are you today?
Good. How you doing?
Good. Thank you for asking. How are you? you get some good rest last night?
A little bit, not a
A
lot.
little bit?
Yeah.
Good. Did you get a good meal last night?
Yes, very good.
Good. How you feeling today?
Good.
Good.
Yeah, a little nervous, but I'm actually looking forward to it.
Good. We're very excited as well, so.
We'll get you sedated, very comfortable, and we'll start. Okay.
Thank you.
Surgery shouldn't take me more than 2.5 hours, 2.5, 3 hours. So
I thought
it
it
should be
was
pretty straightforward. Okay.
For
Just
you.
relax.
This is
Just
awesome.
relax. You're not gonna remember or recall any of this, so you're not gonna have any recollection.
Thanks.
So let's go ahead and get started. Okay, on gym we started at 12:30, and we extracted all the teeth, remodeled the bone, and place our implant, place our abutment, which gets connected to the bridge, and we are ready to suture it up. Right now the time is about 1:15, and we're basically done with the top. So since we do this every day, in and out, day in, day out, you know, we basically fine-tuned everything, and it's a pretty straightforward process when you do over 5,000 of these.
Can you tell me a little bit how you doing?
Good. Got home last night. You know, still, I guess, groggy from, you know, the sedation, which is fine. It was actually a lifesaver for me. I'm talking funny now because I'm waiting for my teeth, but looking forward to it. All the apprehension and anxiety I had pre-yesterday seems foolish now. You know, the assistants were phenomenal, to the point where they were even worried about, you know, the room gets cold, you know, here's a blanket, we're going to put it here, and if you get cold, we'll cover you. They explained everything, you know, and I don't want to go into all the details of, you know, what they explained, because it would take a while. They prepared me fully for what was about to happen, and I was amazed. In fact, when I laid back and they set everything up, I felt so much anxiety gone, and that was before the anesthesia. I really felt like I was being taken care of. So, went home, went back to the hotel, laid down, just was resting, you know, because I guess a lot of the emotional part of the day had wore me out. Woke up, and took my medicine just like I'm supposed to, did my rinses, and I'm laying there and I'm like, you know, I took the ibuprofen for the swelling, and I did the rinse, and I'm like, and then there's the other bottle with the pain medication, and I'm like, but I'm not feeling any pain, so I'm just not going to take it. And I still haven't taken, I haven't even opened the bottle yet. And, you know, here we are, you know, surgery was yesterday. I got up this morning, you know, I actually had my first cup of coffee in a couple of days, and it was nice. Me and my wife were talking, and from my wife, she was saying, I really like that office. I think this is, you know, the best decision we could have made. And me being very skeptical, naturally, and before I was, oh, what about this, what about that? I just looked at her and I said, I agree with you.
A little pressure. So it's fairly easy to put them on. It takes like probably 2 minutes to put it on. We'll take it off. The implant stability was very good. You have a really amazing bone. Okay, the top one is in. That took us probably less than 2 minutes. Again, everything is computerized, everything is CAD CAM, so it's much better than handmade. Handmade teeth, most places they use denture teeth and they put them together hand one by one. Okay, top one is in, looks great. Let's do the bottom. A little bit of pressure again. Right down, tap your teeth. Tap, 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 tap. You look amazing, Jen. You look amazing. Let's just sit around.
Great.
The most easy dental, thing or
Experience,
You were
yeah.
saying, you're gonna feel the pressure. You have to see what other dentists do. People. I'm telling you.
I know.
I'm telling you.
There's some rough one out there. I
Oh,
know.
man.
All right, let's take a look.
Big smile. I know you're still numb.
Wow. Let me take this off. Wow. Now also, I had Bell's palsy.
At one time.
Yeah, so
the right
it
side
droops a
sort of
little.
droops down a little bit more.
Yeah, so that's
Yeah.
not your fault.
Yeah.
Wow.
Wow, look at you.
You should.
Give me a big smile, buddy.
You know what? If they're not having teeth in some, the back and stuff like that,
Yeah,
I'm adjusting.
because starting
But
out, we just
I'm
had.
dying to see what my wife says when I walk out and smile at her.
Yes, of course.
Wow.
You're gonna be able to chew on that right side again because you just had the
Oh,
the
man.
front there and then on your left side. So you're missing all those teeth on the right side. So you're gonna be able to chew again.
It's kind of hard to stop smiling.
Let's do a little bite adjustment. You're still your lip on top, even though you feel like it's not numb, but it's still a little bit inflamed. So once that inflammation goes away, your smile line is going to be higher.
Yeah. Oh,
Okay.
yeah. I mean,
Yeah. So
You-
it's.
I've been looking at my teeth for 5 years. What the last dentist totally destroyed on me, my smile, and you just gave it back to me.
Awesome.
I mean, I can smile.
You can eat anything you want. Those implants went in at a very good torque. Like again,
I mean, I have teeth again. I
Yeah.
have teeth again.
Awesome. It's gonna take a few weeks for you to get used to it. After 6 to 8 weeks, you can't even tell it's there. It just becomes part of you.
It took me 5 years, and I still didn't get used to what the other guy did. I'm telling you, I'm being honest with you. This is a home run. This is a home run.
Very nice. What do you think, honey?
Me? I
Yeah.
have a smile again. I can smile.
Awesome.
You like them?
I do. Do you like them?
You're welcome.
That's all that matters. I'm so used to seeing you the other way.
I just have to get used to having teeth now.
Yeah.
But I mean, the smile, when I smile, it fits. It all fits. It's not the angle down and those big chiclets, and they
Right.
fit their teeth. They look just,
They look like teeth.
like my old teeth. Yeah.
Great. That's awesome. That's all I want to hear. That's great.
It shows the force.
Exactly. It shows me the force, and then it shows me. Let me go back again. So this. once it gets finished.
Yeah.
So you were here before. Now you're here. So this diamond, we want it to be in the white or even in the gray circles.
Right.
Okay, so the load is distributed between both right and left side. Because a lot of times when we do this, patients, some of them, they don't have teeth on one
Right.
side or the other, and they can't tell, you know? They might not
Well,
tell
I
me the
couldn't,
right,
obviously, yeah.
Yeah, you were telling me the right, but it
Yeah.
was completely the left side.
I don't want you to disappear.
No, I'm not gonna disappear. That was a great thing, you know? You were a great patient.
I can't say, I don't know, there are no words for me to say thank you, all of you.
You're welcome.
Thank
It was
you.
my pleasure. So I'll be back.
We'll also give you a water pick before you leave here. It'll look like so.
Great.
The water pick brand is the one that we like to suggest patients use. So we'll give you this one, and then I'll go over to like the hygiene instructions for you to keep them clean, but that's going to be your primary source, so
Okay.
we'll go over that, okay?
Great, thanks. I mean, what he built here, there should be these all over the country.
All right, Jim. We did the teeth, but the hair, that's gonna be another. That's gonna be another. That's another story.
Wait a minute. I thought this was a full service shop. You know, I'm just sitting here laughing, but I'm laughing like smile laughing.
Great,
In the old days, I'd be like,
You're laughing inside.
no, but no, I would
it's
keep
like-
my mouth closed.
Right.
I'm done. And that's so funny.
That's awesome.
Okay, so we ready for pictures?
Yeah, oh
I'll
yeah.
take pictures.
Yeah, let's
You
take
got the
pictures.
Golpa.
Yes.
All right.
I think you're impressive, yeah.
There we go.
Awesome.
Okay.
I cannot.
Glad I could do this for you. Seriously. Awesome.
I just feel like I can't stop smiling. I know you hear this all the time, probably.
No, I mean, yeah, I do hear it all the time,
You
but
know,
it's a great feeling.
Yeah, I can't. I can't put it into words. So thank you doesn't seem
No, it's
near enough.
It's
I
enough for
mean,
me.
He said, in the room, he said, he's an artist, that's what he is.
You know what? I've been to a lot of dentists, and you are not a dentist. Seriously, you.
Thanks, thank you.
You know.
You're gonna take one with that?
Yeah.
Yeah, the ones to
So we
take.
can.
Yeah, sure. Sure.
No, are you kidding me? Can I smile first? Yeah, take it on. Yeah, take some more. Yeah.
Close up.
You just want to keep smiling.
Yep.
Selfie.
Now I'm gonna be doing it. You watch. I'm gonna
Great.
burn Instagram up. I've sat in a lot of chairs over the years trying to
I
correct the. You saw how bad they were.
Yeah.
And I never even believed that. You're gonna go in and get implants, and the pain, and all these
Right,
things
right.
would go through it. The
Right.
anxiety.
And all the things you hear from other dentists,
Exactly.
other patients, how long the procedure's gonna take. A lot of them, they want to do bone grafting
please!
and all that,
I mean, I went to 4 or 5 other guys who were specialists of this, and we actually even signed up for one. Turned out to be a whole big kind of a scam thing, and we went in. Very first thing you would hear is how great they were at this. When I first met you, you were looking at me, you were talking to me about me, and you didn't say one thing about yourself. You know what I mean? To me, then, it registered in my head. And then, as I just got to know you, this is a family. This is a family.
I get a really friendly staff, so they're like,
Well, and
they're like family to me
But
as
they-
well. So
but they're, when they talk, the work they do, the level of confidence that I felt, and I was very anxious. I was a high anxiety person. I can tell you, yesterday when I got back to the hotel after the surgery, before my teeth, that was all gone. Because I don't, just the going through everything I went through here, meeting the people, talking to the people, how I got treated.
I'm glad you did too.
My wife got up this morning and said, after being here all day yesterday, she says, we definitely came to the right place. And me, I'm a very big skeptic about everything. I do computer security and I'm, I always believe trust but verify. And she said that before. I think he's the right guy. And I'd be like, we'll see, we'll see. Well, yesterday when she said that, I turned around to her and I said, yes, we did. And I think she was going to fall off the chair.
That's awesome.
I'm never right.
I haven't done this for a long time. Apple, here we go.
Wow.
That is good.
How does it feel in your teeth?
I have teeth all over. Not like I'm aiming to get my teeth to bite the apple. It's perfect. It's perfect.
Fantastic. Could you do me one more favor? What are your parting words to somebody who's considering doing this?
That being a person who is very anxious about my teeth, dentist work in general, and after looking into this and the anxiety, when I'm looking back at it now that I'm on the other side, do it, because it is without a doubt the single best thing I have done to get my smile back. I feel more confident. The process in my mind was 100 times worse. I made it worse in my mind. The process was smooth as silk. The people were great. And like my wife says, I can't stop smiling now. I have my smile back, and I am very grateful for this, this group of great people and what they did for me.
For more information, go to www.allon4.guru, or why not call the number you see on the screen right now for an appointment.